can choose to kill you right now. It's the appendix. It's an organ that's so potentially dangerous that NASA has considered having its astronauts remove it before they go into outer space. 1 in 20 people will get appendicitis, and that's one person in this room. I'm going to go tell you something about the appendix, how appendicitis happens, and the medical procedures that happens once you think you have it. So, what is the appendix? The appendix is part of the digestive system. It's located between the large intestine and the small intestine on the large intestine side. It's on the right side of your body, around over here. What does the appendix do? Well, some say it actually doesn't do anything. For example, according to Mary Evan Hone, 8th edition, Anatomy and Physiology, the appendix is just a vestigial organ. But others say, such as the more recent scientific community, it stores bacteria that are useful for educating the immune system. So now that you know what the appendix is, here's what might go wrong with it. Appendicitis is inflammation of the appendix. It can occur when something blocks it. Inflammation occurs when your body's trying to fight infection and causes swelling. Some signs and symptoms unique to appendicitis are you can experience stomach pain that just causes nausea and vomiting, fever, and this doesn't go away. And something very unique to appendicitis is that you can't pass gas. Most of the time when you have stomach pain, it's going to go away after you fart. You actually can't do that here. So now that I told you about appendicitis, here's what happens when you think you have it. So here's a way you can check if you have appendicitis. Between your bump over here on the right side of your body, it's called the anterior superior iliac spine, the ASIS, and your belly button, there lies a thing called McBurney's point, right over here. If you think you have appendicitis, you're going to feel a sharp pain when you press right there. And if you think you do have appendicitis and your doctor is available, you can tell him to order a complete blood count, a CBC, which will check for those bacteria that come up when your appendix gets inflamed. Treatment often involves emergency surgery. You'll get an appendectomy, which is when they come into your body, take out the appendix. This can be done using just a tube called an endoscope. It's less invasive than traditional surgery. So, in conclusion, the appendix is an organ in your lower belly area. If it gets blocked, it can swell and potentially burst, killing you. You can test if you have appendicitis by pressing on McBurney's point. A doctor can confirm this test with a complete blood count and order an appendectomy. Appendicitis is a dangerous condition, but one that you know how to recognize. According to a study done by Texas A&M, 7% of all people get appendicitis, so know the signs and get checked at a hospital. Thank you.